dreaded Stylets and ET tube. By itself, this ET tube is soft, has some rigidity, but may not be able to get to the destination you want, which are the chords, as desired. With the stylet, it may assist you easier in directing the direction of the tube, as it's in the small compartment of the airway of the oral pharynx. Okay? Some of you are going to be taught a mythology that it causes trauma. The only way this really causes trauma is if you do this. Don't pay attention, and the distal tip protrudes from the other end. If it protrudes from the other end, you might as well just tattoo J, D, T, J, R, M, D was here, or just JT was here. You're going to cause injury to the soft tissues doing this. So please pay attention to how you place the stylet in. Now, my arguments against not using the stylet, or the ones I've heard in my career, have been from anesthesia that say it's going to cause trauma. Well, guess what happens when my students or my residents try to intubate in anesthesia? They will be told, please do not use the stylet. It causes trauma. They go in, small mouth. They think they see the cords, but when they get there, it keeps going underneath. They can't direct their tube directly into the cords. Then they'll have to give up the airway to someone else, this person more senior. Then that person gooses it because he can't get the distal tip through the cords. So guess what happens after that? And I almost liken this to like opening a door with your eyes closed in a dark room. Why? If it assists in getting you the tube in, worry about that. Okay? This will allow me first pass access. So why is this such a bad thing if you are going to be using it, if you're the senior person in the airway, doing the airway? Alright? Go in. It'll help me out to visualize and get the tube in. Avoid going through the line of sight through the channel that's been provided by the blade, spatula of the blade, going from the side. Only at the end, place the tip in. Okay, I'm going to tell you what causes more trauma than anything else. It's me crushing the epiglottis, me using it violently as a Miller blade, which I have endorsed that sometimes if it's an emergent airway and the patient's getting sick and you're the only one to get the tube in and there's no backup, nobody do your laryngoscopy, you can use a blade, a Mac blade, a curved blade as a Miller slightly, but be cautious, be gentle, not crushing it, crunching it, and wondering why this guy aspirates for the rest of his life because you tore his epiglottis into pieces. Alright? That causes more trauma than the stylet. Okay? Another argument today, this video is almost another argument you can say to use bougies. Less traumatic, anything with a blunt edge can cause trauma, but less likely since the bougie does not have a sharp edge. But that's another talk on opinions versus using a stylet versus the bougie. Okay? Thank you.